Hello, my name is Gabriel Gan, and this is my presentation assignment for leadership and management. Hmm. My scenario about conflict is just about a situation between a nurse and a nursing assistant that they did not get along in regards of the care of their patients. The assistant refused to help to get more supplies for the nurse, just due to the fact that the nurse had asked him some supplies recently. It's all about the back and forth favor, and the assistant raised his voice and made a scene. The nurse explained that she did not realize that the patient would need as much as supplies while she was in the room. So the nurse manager mediated and decided um, to have the two parties to collaborate and accommodate one another for the patient's sake. It was all about having a plan for that night. On that note, too, this is actually on a COVID unit, so they're trying to minimize the in and out of the going inside the room as much as possible. They want to get everything, supplies, everything about the task to go in the room, so you don't really have to spend so much time in the patient's room. But unfortunately, that night that the nurse didn't anticipate that she would need more. But basically, on the conflict resolution is the nurse manager mediate on both of them, and she used more like the collaborative accommodating approach. Um, and it's all about a good communication for good communication to establish good communication for both parties. These are the different conflict strategies. One is compromising. It's about to compromise. You encourage both of the parties to give in some points. The both parties cannot have all what they wanted, but perhaps probably meet me in the halfway kind of thing. It could be more time consuming because it it takes time to meet like a in between, the happy medium, whether one party is going to give in or the other party is about to kind of like how much they're going to give in. It requires more people skills, and it could be a win-win situation for both, as long as if they're able to come to terms like in a happy medium or like in between. Next is competing. This is actually opposite of the other one. This is one party is stressing out their position without the regards of whatever the other party wants. In this particular, and it's a win-lose situation. There's only one party win. You have to take a quick action for this. Whatever they decided on, it's gonna be not a popular decision, since the other one is not really going to win or it's not going to go in their way. And in some cases, if one party is a little bit more dominant, the other party might need a little bit of protection just because of their weakness can be exploited. Next one is cooperating and accommodating. This is just a little bit more like they're trying to not to compete with one another. They're gonna try to give in, but it's not like the first one, the compensation, because it's not really a give in, but you're pretty much gonna come across to not like a happy medium, but whatever you guys both win. It's not gonna be fully to the extent, but at least um there's one is doesn't have to give up as much as the other one. Smoothing. It needs management conflicts. Used to manage conflicts. Used to have one party to accommodate, cooperate with the other. It's just smoothing things out. It can go hand in hand with accommodating or cooperating. It's kind of close to that regard. And the emotional aspect is minimized. Basically, you just have to put the ego aside. Avoiding is the one that doesn't. The one party wants to avoid. They don't want to confront the issue. You have a tendency to see if time permits that it's going to resolve by itself. So it it may resolve by itself or it may not. That leads to unsolved conflict. Maybe the opposing party is a little bit more powerful than the other one, that the other part doesn't want to put up with it, doesn't want to deal with it. And like I said, the conflict might remain unsolved due to its not being confronted. Collaborating is basically trying to, it's kind of like, I feel like it's kind of like close to accommodating, because you're trying to collaborate, see it comes out, which a better solution will comes out for both parties. This is the scenario when I delegated. It's like when I delegate my fellow critical nurse to hang another bottle of sedative for my patient while I was being very busy with the other critical ill patient that I have. The delegation was appropriate because my fellow nurse is actually qualified to do the task. She was familiar with the process. She was familiar with medication. I did not delegate this to my nursing assistant because this is not part of her scope of practice, and she's not licensed to do so. The 5 rights of delegations as follows. First is the right to task. Basically, the task has to be legally appropriate for the one that you're going to delegate to. And part of that, it should be appropriate for the person's scope of practice. So one of the examples are, as a nurse, I can delegate my nursing assistant to obtain a set of my patient's vital signs because that is part of their scope of practice. But I cannot ask them to go ahead and assess my patient because they are not licensed or they're not certified to do so. Next one is the right to circumstance. It's for the appropriateness of the setting, of the environment. Make sure the delegation is within policy and procedures, and again, it's the scope of the job description. For example, it's like a critical care nurse delegate the care for a patient with another critical care nurse, but not to a nurse that is not familiar to take care of critical ill patient. It's like my example earlier. I delegated to my fellow critical care nurse, not asking to another nurse that are not familiar to take care of those kind of patients. Next one is right person. It's about a person's qualifications, their scope of practice, competent for the job, and if they're familiar with the task. Examples are delegating patient care, again, to a critical ill patient to another critical care nurse instead of a medical surgical nurse, which is a totally different specialty. A right to direction and communication is basically providing clear and concise instructions. A delegatee understands and accepts the task in hand. Like, they don't have any problem. They understood what they need to do. They understood what they really need to do the task. Examples are delegating a nursing assistant to recheck patient's blood glucose exactly 1 o'clock in the afternoon or 1300 hours instead of using the hand, but make sure that they use their earlobe for some reason, and a nursing assistant actually verbally understood and agreed with the task. Right to supervision, it's considering of the level of supervision that may be direct or indirect, be courteous and respectful with the feedback, and should have a teamwork approach with this instead of being superior to them. Is when the nurse delegated the nursing assistant with regards of rechecking patient blood glucose. The assistant reported back to the nurse, and the nurse gave respectful feedback. With this task, indirect supervision was in place. This task doesn't need to be in direct supervision with the nurse. The errors in delegating is under delegating. One of them, basically, it holds it back, and the person holds back in delegated tasks. Maybe because they don't trust the person that they're delegating on, and sometimes whenever that goes, it leads to micromanaging. Next one is over delegating. This is basically like delegating pretty much every single thing. It burdens the subordinates because it's too much piled up tasks that's being delegated to, and maybe because the person is delegating is very insecure about their ability to do the task, so they're rather to have somebody do it. The last one is improper delegating. It delegates at the wrong time, the wrong person, based on their qualifications and scope of practice, and for the wrong reason in terms of like you giving them the task. In order to create a healthy work environment, um, it's ideally to maintain a positive outcome in a stressful atmosphere, promotes employees' motivation and happiness, positive work culture, promote healthy and safe work environment, promote wellness, and implement fair policy for everybody. Everybody has to be equal. The components of healthy work environment, it has to have skilled communication, a true collaboration, effective decision making, appropriate staffing, meaningful recognition, and authentic leadership. My personal work environment, as for the most part, is healthy. Bullet points, I have, we all respect one another. We have a good relationship with one another. Everybody help each other to take of our patients. It's not just my patient. Everybody's taking care of everybody. Um, the manager treats us equally, and he's always available to staff. He's very approachable. He gives us opportunities in learning and for training, additional training. And I do have a positive workplace. Personally, the only negative is being short-staffed most of the times, but I feel like that's pretty much goes with mostly in any workplace. It's just a little challenging for us because we, um, I work in a critical care unit, so having extra patients that is not supposed to, it's kind of challenging and sometimes quite unsafe. The effective leader should give employees of autonomy, avoid micromanaging. Great communication, has to have great communication with employees, open all the time, treat employees with equality and with respect, celebrate events and encourage social activities in workplace, and make sure employees have what they need to get the job done. That's one of the important parts too. And these are all my reference. Thank you very much.